Hello, good morning, good evening, good afternoon, everybody around the world. Welcome to our session on investing in healthcare and the status of the situation with the pandemic. My name is Peter Diamandis. I serve on the board of the FII. I am co-founder and vice chairman of COVAX and Vaccinity, an organization developing vaccines and blood antibody tests in this arena. I'm currently joined by one of my panelists, Dr. Ali Parsa, founder and CEO of Babylon Health, and waiting my other panelists as well. Dr. Parsa, are you there?
I am here, Peter.
A pleasure. Well, let's begin with the service that you are providing currently around the world. It's COVID-19, the whole pandemic has been an extraordinary race to retool the healthcare industry, to take it from effectively a standing start for this pandemic and to provide services much needed globally. I'm going to ask you this question: if you knew back in the first quarter what you know now, what would you have done differently? What would, if you could go back in time or to get ready for the next pandemic, what would you be able to offer as a new strategy?
I think, Peter, what we did through almost centuries and exaggerated it in the last few decades was we had a system in which we waited for people to get sick and then we treated them. So while we call it the healthcare system, in truth is that we have a sick care system. We wait for emergencies, crisis, and then we deal with an individual. And when the pandemic came, if you remember, at the very beginning, we started people to our house, so our doctors, nurses, asking them to treat them. But we very soon found out that that strategy would not work, and we need to have a more proactive strategy of keeping people healthy. In some places, we had to go to draconian measures in order to be able to do so. And I think that what we should learn out of the pandemic is that the model of healthcare that waits for things to break down, for emergencies, crises to happen to individuals, is a model that we abandoned, if you wish, in almost every other asset. Your car used to break down, you used to take it to a mechanic and fix it. Today, we buried enough sensors in that car and we'll take it for annual services. Your car just never breaks down anymore. And that's what we need to do with human body. We have technology to be able to continuously monitor people, to see trends, to try and keep them healthy, and then when emergencies happen, only then to try to take them for cure. I think that model of healthcare, I hope, will come out of the pandemic that we've seen.
Let me go. We've been joined by His Excellency Dr. Harsh Vardhan, Minister of Health and Family Welfare, Minister of Science and Technology of India. Your Excellency, thank you for joining us today. India is a extraordinary nation, both in its size and its science and technology. I'm curious how you've seen the pandemic and how India has been scaling up. What are the most important lessons you've learned in the last few months that you want to share with people?
Good morning, good afternoon, and good evening, my friends all over the world. Thank you for inviting me to the Future Investment Initiative Forum. It is indeed an honor and a pleasure for me to participate in this prestigious event with so many distinguished guests. My special word of thanks to His Excellency Mr. Yasser Al-Rumyan, Chairman of the Future Investment Initiative Institute, for his gracious invitation. Your country and its people have been a constant source of energy for the world economy. And I too can feel the same energy radiate to me as I talk to you today. I bring to you greetings, salam, from the people of India. Assalamu alaikum to the people of Saudi Arabia from the people of India. Government of India is grateful to Kingdom of Saudi Arabia for taking excellent care of the Indian community during the pandemic, be it in the form of making health facilities available to Indians suffering from COVID-19 or ensuring orderly repatriation of the people wanting to come back to India. Dear friends, today we are meeting in exceptional circumstances on the sidelines of a great battle, a battle that humankind is fighting valiantly, a war against a tiny pathogen which has taken away many of our honorable men and women, a war that has inflicted death and pain upon millions of families across the globe. For the first time in history, a health crisis has shut down the entire global economy, painfully demonstrating how inseparable healthcare and the economy have become. It is evident that the current crisis will inevitably reshape the world we knew. I would say that mankind will be able to recall only one event from 2020, and that shall be the story of the deadly and unknown virus that wreaked havoc across the globe, killing 1.5 million people and causing unprecedented economic devastation. And yet, history will also recall how science raced to the rescue of humans and how research and development with global collaboration became the focus of healthcare and survival. Today's topic of discussion, Health of Nations, a guide to investing in the next decade of global health, is therefore extremely relevant and important. Many questions come to our minds. The post-COVID world has thrown everything out of gear. The economy, the society, the politics, the technology, and the environment. As the fragile economies crumble under the impact of this deadly disease, the developed nations have been equally thrown into a recession. Will the world economies rebound? Will they absorb this storm? Will they enter an expanded recession? No one knows. There is a behavioral change in society. Some say families have been never so close. Yet others say that xenophobia is on the rise. It is going to be a game of survival of the fittest, and that shall change our society, its ethics, and all interpersonal norms. On the political front, there is heightened nationalism. Are countries going to trust each other? Is there growing interdependence, or is there growing isolationism? Never before were innovation and technology so relevant to our lives. Is it now going to remain focused on healthcare for the next 2 decades while we struggle to emerge from the after effects of the pandemic? The pathogen taught us to come out of the state of denial, where we thought constant damage to the environment was not going to change our lives for the next few generations. Today, there is a completely new focus on sustainability, but will this focus remain? All these questions and plausible answers are critical to contextualize the future of healthcare systems. The lesson to humankind is clear, that health is intrinsically more important than everything else for now. We also understand that on the healthcare front, strengthening emergency preparedness and risk management is key to addressing the health risks posed by emerging diseases and for progress towards sustainable development goals. While we all understand that therapeutics, diagnostics, and vaccines for the whole world was the only way out of this pandemic, we never realized how global collaboration was paramount for this. We have also in the last 1 year realized how governments, industry, and philanthropy must pool resources to pay for the risk, the research, manufacturing, and distribution, but with the condition that the rewards should be available to everyone, regardless of where they have been developed. To begin with, it has helped nations realize the importance of long-term investment in the healthcare system. Countries have now begun investing in new medical facilities and infrastructure. Now, healthcare cannot continue to be managed as a cost, but it needs to be approached as an investment. Secondly, another effect of the pandemic has been the rapid expansion of telemedicine facilities. Thirdly, the healthcare and industry is in the midst of a digital transformation, and the technology giants want to rush in. The pandemic has given rise to innumerable health startups. Lastly, the pandemic has also helped us realize that the healthcare industry, policy makers, and tech companies have to work together in order to have a comprehensive security net against such unprecedented medical emergencies. I am happy to report that India has been one of the most successful countries in handling the pandemic. The positive developments taking place in our country are a result of the strong political will exhibited by our Honorable Prime Minister Shri Narendra Modi ji. India took early and swift decisions as part of its containment strategies to mitigate the virus. Stringent measures that were well implemented, coupled with exceptional cooperation from the citizens, helped us to maintain one of the lowest case fatality rates in the world throughout the pandemic. Friends, healthcare is an important responsibility of any government. And I feel very proud to highlight here that recently on 16th of January, India has launched the world's largest vaccination campaign, and we have developed 2 COVID-19 vaccines indigenously. Not only that, many more vaccines are also progressing at a rapid pace. This is a shining proof of India's strength, India's scientific proficiency, and India's talent. I am also happy to inform that we have been able to supply this vaccine to several countries in the past few days. Covishield vaccine will also be supplied by Serum Institute to Saudi Arabia. Today, I also want to assure you from this platform that the pace of progress in India will continue on an upward trajectory. We are taking every decision possible for the development of our country. Our policies are unambiguous and the goal is fixed. We are improving not only the ease of doing business, but also the ease of living. I invite you and the businesses from all over the world to partner with India in this journey of global welfare. Today has been a great honor for me. Dear friends, I thank you very much for this great opportunity and offer my heartfelt gratitude to His Excellency Yasser Al Rumyan, Chairman, Future Investment Initiative Institute. Thank you very much. Shukran Jazilan.
Thank you, Your Excellency, for your remarks. We are grateful, and truly India is doing extraordinary work. Dr. Parsa, if I may, this year has become one of the years of the greatest investments yet in healthcare. We went from a standing start to digitizing, dematerializing, demonetizing, and democratizing a whole slew of different services. We hit all-time highs in venture investing in the first part of this year that I think are going to pay dividends and give birth to a multitude of new companies in 2021, 22, 23. One of the things I believe is that we're going to move healthcare out of the hospitals into the home, out of the institutions into a personalized, digitized element. What are your thoughts along those lines?
I couldn't agree more. I think what we've seen with any industry has been a movement from the complex to simple in the model of delivery. So this telephone conversation we're having, I remember there used to be a time when I was a tiny child growing up that we had to go to the phone houses, telegraph houses, remote towns, if I was there, to make a phone call. That moved into the streets, then moved into our houses, now it's moved into our pockets. And I think the same trend will undoubtedly follow in healthcare. But I hope more than that happens, which is go from a reactive model of healthcare, as I was mentioning before, to a model of healthcare that is continuous. So from one that is incidental and from time to time, to a model of healthcare in which we're continuously collecting data on people, we're continuously assessing their health, we're continuously providing insight, not just necessarily to them, but through our own AIs. And we're setting up goals in which we follow people through care and monitor them to be able to reward them, but also when things go wrong, to alert and intervene. I think that fundamental restructuring, re-architecturing of healthcare is what I see some startups doing now. I see some health systems in the United States, for instance, doing it with some of our clients and us. We're working together on this. I think that is where the true excitement comes. That's using digitization not to repeat the existing model of healthcare, but to reimagine it from a reactive way of dealing with crises and emergencies to a proactive model of keeping people healthy.
Another question I have, and perhaps for both of you, is at the end of the day, during a pandemic, who owns delivering the care? Is it solely the government, or should companies be stepping up to protecting their employees? Where are we on government and business working together to make sure that that we're able to provide very rapid care? Dr. Vardhan or Dr. Parsha, do you want to comment on that?
Yeah, thank you for posing this question. I think what I can comment right now is based on my experience of the whole last year, since the day we had the news of this coronavirus entering the whole world through the news break from WHO delivered by China. Last 1 year, we have seen that at least in India, it has been a whole of government and a whole of society approach, and everybody in the system, whether it was the professionals, whether it was the industry, whether it was the corporate sector, whether it was the pharmaceutical industry, everybody was on board. And everybody worked together, and that is, I always say that it is not for India itself, but for the whole world. The greatest benefit, unfortunately, COVID, we lost so many people all over the world, but the greatest you can say blessing in disguise in some form has been the type of collaborations and the way people have worked together, not only in a country but all across the world. So this is, I think, something which COVID has probably reminded us. It has brought health to the center stage of everything. People now, whether in government or in administration or in the society or anywhere, they are forced to actually focus on health issues and newer technologies, newer and newer ways of actually handling health. Like we were earlier also talking about and doing something about telemedicine. But during the COVID pandemic, we we in fact finalized all our telemedicine guidelines, in fact notified them in a big way, started practicing them in a big way, and right now telemedicine has also become some sort of a norm in our country, where the highest, you see, most educated and most experienced teacher of a medical college, to him, means for the poorest of the poor living in the remotest part of the country, they have access to his professional advice through the telemedicine facility. So there is a lot of change that has happened, and everybody has played his definite and well-defined role in this. Everybody has worked like a team. And just to give you an example, the
And Your Excellency, I apologize to interrupt. We are out of our time window, and I want to be respectful to the next panel. I am
no,
grateful.
it's all right. No problem.
Grateful for the extraordinary work that India has done. I know my company Kovacs has partnered with one of the large manufacturers, Aurobindo. And Dr. Parsa, thank you for the work that you've been doing with Babylon Health. And I turn the stage over to our next FII panel. Thank you all very much. Be safe, be healthy.